Welcome to this edition of A Healthy You. Today we're talking about meningitis. Meningitis is a serious illness, and even with all advances in medicine today, it is still highly prevalent throughout the world. Meningitis is an inflammation of the meninges, the membranes that cover the brain and spinal cord. More than 5 million people worldwide get meningitis every year. About 180,000 die each year. Meningitis is easily spread between people living in close quarters. However, children are at higher risk for infection. Bacteria and viruses cause meningitis and can be associated with other routine illnesses that are contagious, like chickenpox and measles. Bacterial meningitis is rare, but usually serious and can be life-threatening. Viral meningitis, also called encephalitis, is relatively common and far less serious. Meningitis can spread when a person coughs, laughs, talks, or sneezes, and can also spread through a person's stool. Sharing food, drinking glasses, eating utensils, tissues, or towels can all transmit the infection as well. In some cases, the bacteria is spread from a severe head trauma or a local infection, such as ear infection or nasal sinus infection. Viral meningitis tends to cause flu-like symptoms, such as fever and a runny nose. However, most cases resolve completely. Symptoms of bacterial meningitis include flu-like fever, feeling lethargic and irritable, but also include headaches, stiff neck, seizures, skin rashes, and eye sensitivity to light. Infants may also present with extreme stiffness of the body and neck, bulging fontanelles, poor feeding, a high-pitched cry, and also jaundice, a yellow tint to the skin. Complications can be severe and include hearing loss, visual impairment, seizures, and learning disabilities. Most people who receive prompt diagnosis and treatment recover fully. A lumbar puncture or spinal tap that collects a sample of spinal fluid tests whether a virus or bacteria is causing the infection. A child who has viral meningitis may be hospitalized or treated at home if they're not too ill. Treatment, including rest, fluids, and over-the-counter pain medication, is given to relieve symptoms. If bacterial meningitis is diagnosed or suspected, the patient is hospitalized, fluids are given, and antibiotics are started. Some patients may need supplemental oxygen or mechanical ventilation if they're having difficulty breathing. Routine immunization for illnesses, like chickenpox, can go a long way toward preventing meningitis. Good hygiene can prevent infection. Wash your hands thoroughly and often, particularly before eating and after using the bathroom. Avoid close contact with infected people and don't share food, drinks, or eating utensils. Bacterial meningitis is serious. If you suspect that your child has any form of meningitis, it's important to see the doctor right away.